The broadcast is now starting. All attendees are in listen-only mode.
Welcome to our webinar this evening, Diabetes 101, Mastering the Essentials. Um, if should you have any technical difficulties during the broadcast, there is a number to call at the bottom of the screen. You want to call Citrix Support, and the phone number is 1-800-263-6317. Again, thank you for joining us this evening and welcome to our webinar. Our format includes a short presentation followed by an interactive discussion. To type in a question, use the questions section of the webinar toolbar. At the end, you will have a chance to ask questions, so we look forward to an interactive webinar. We know that the information you're about to hear may motivate you to make lifestyle changes, so please consult with your physician before making any changes to your current routine. This online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health Certified Diabetes Educators. So our webinar leader this evening is Emily Gibbons. Emily is a registered dietitian and a certified diabetes educator practicing in Ohio for the past 14 years. She earned her bachelor's degree at the University of Dayton and completed her postgraduate internship at Johns Hopkins. Emily spent the first 8 years of her career working in dialysis prior to becoming an outcomes coordinator and certified diabetes educator for a local hospital system. Emily is currently a senior team lead and certified diabetes educator for Cecilia Health. Recently, she was awarded the Certified Diabetes Educator of the Quarter award at Cecilia Health. In addition to this rewarding work, Emily is also actively involved at the local level as the program coordinator for the American Association of Diabetes Educators. Emily is passionate about diabetes and has committed her career goals to empowering and educating patients with diabetes. So thank you very much, Emily, for being with us this evening, and you can take it away.
Alrighty, thank you, Katie. Perfect. So today I just wanted to quickly go over our agenda just so you get an idea of what we're going to be talking about today. We are going to be talking about what is diabetes, the diabetes diagnosis. We're going to talk a little bit about blood sugar monitoring and how to do that. We'll get briefly into some of the diabetes medications, kind of an overview. Also, a little bit about diabetes complications and prevention, and then what to eat. So a diabetes eating plan. And then, of course, any questions that you may have. But again, it's just we're going to highlight, kind of hit on all these topics and just kind of an overview of them. Please, please, please talk with your healthcare provider before making any changes to your diabetes treatment plan. Okay, so let's get going here. So what is diabetes? So, you know, there are approximately 30 million or 9.4% of the population has diabetes. And actually 1.2 million of that 30 million are type 1 diabetes is what we call. So the vast majority are type 2. There's about 1.5 million cases of new diabetes each and every year. Lots of millions, 84, 85 million Americans have pre-diabetes that are age 18 or over. And actually a big population of this now is your 65 and older population. There are about 25% of our seniors have diabetes diagnosed and undiagnosed. So back to the type 2. So that's the most common form. So this is, we're going to mainly focus on type 2 for this particular presentation. So again, the most common, most popular form, it is when the body does not use insulin properly. Okay, so the body makes insulin, it's just not using it properly. The pancreas may make extra insulin, but it eventually ends up not being able to keep up with this need. What happens is glucose builds up in the blood, and so instead of going into those cells, cells are starving for the energy, for the sugar. Okay. It can be treated with a number of different ways of treatment. So unlike type 1 diabetes where you need insulin because you're not making insulin, type 2 diabetes can be treated with lifestyle changes, some or with insulin through insulin shots or maybe an insulin pump in some cases. Okay. And just so you're aware, insulin is a hormone that is produced by the pancreas, and its job. All right. So, diagnosis of diabetes, there are a few different ways that you can get diagnosed with diabetes. So, one of the things might be an A1C. So go to the doctor's office, they do some lab work, and they figure out what your A1C is. This is your average blood sugar over the past 2 to 3 months. That's your A1C, and it comes in a percentage. So it's the only one of these that's going to be a percent. Your fasting blood glucose, that's going to be done in the morning. So that would be one where you might have to go get your labs done. You can't eat for 8 hours prior to the test. You go in and you get the lab done. That's another option. Oral glucose tolerance test. So this might be after you drink a really sugary beverage. That's an option as well. And then a random blood glucose test. So this could be any time of the day with symptoms. So sometimes we see this in the hospital setting when somebody comes into the hospital and they're excessively drinking and they're excessively urinating, and they have some of those classic diabetes symptoms. We do a blood sugar and it's 275, and they have some of these symptoms. So you can also get diagnosed randomly throughout the day, may or may have eaten around the time of the lab. So just to kind of break that out further, you can see here to the left, you have A1C, and you have your A1C levels of the percentages like I was telling you. So diabetes is a percentage of 6.5% or greater. Pre-diabetes, which is when you don't yet have diabetes, but you're trending in that direction and you may need to adjust for some lifestyle and diet or sometimes a prescribed medication in this stage, 5.7 to 6.5 there. And then a normal A1C is a 5.7. So if you go get checked and it's not 5.7 or greater, you might be in the clear. So in the middle there for the fasting, it would be 126 or greater for the diabetes. For pre-diabetes, you're in that 100 to 125 range. So that's also the pre-diabetes, and then less than 100 is a normal value. And then the oral glucose tolerance test would be greater than equal to 200. Pre-diabetes being 140 to 200, and then a normal blood sugar being less than that 140. Okay. So an A1C, as I was saying, gives a picture of the average blood glucose control for the past 2 to 3 months. A1C represents a glucose level 24 hours a day, including times when you're less likely to check those blood sugars. So when you do a finger stick, you're just checking that one level in time. So that could be before breakfast and then before before you go to bed, say, for example. And that doesn't tell you the whole day. So the A1C represents an average of your blood sugars for 24 hours a day over the course of 2 to 3 months. So it's a little bit more, gives you a little bit more value kind of to your diabetes treatment. Now, your doctor should do this anywhere from 2 to 4 times a year, depending on what's going on with you, I would just, if you don't know this or you're not used to it, I would get in the habit of asking your doctor, what is my A1C? Because this is something you should know about your diabetes. It's an important value. Okay, so benefits of checking your blood sugar. So checking it gives your body a good, or gives you a good picture of your body's response to how you're doing with your diabetes care plan. So for example, if you're seeing some certain periods of the day where you're, maybe you're high when you check 2 hours after you eat, and maybe that could be that you're eating a little bit too much at the meal, or maybe your medication needs to be adjusted, or during periods of activity, your levels are different. So um, checking it gives you an idea of how you're doing with your treatment plan. Also, keeping your blood sugar in range may prevent or delay complications. So keeping that in range is your best bet for avoiding stroke, heart disease, things like kidney disease, um, eye and nerve disease. Also, it's important, especially to monitor your blood sugars if you're taking insulin, because insulin can lower your blood sugars down too low. Having a hard time controlling your blood glucose levels. So during periods of maybe sickness or stress, or where your blood sugars are going up and down, you might want to check them a little bit more regularly. If you're having a low blood sugars without usual warning signs. So this would be like if you were trending down and you couldn't feel those symptoms of being shaky and sweaty and cold, clammy, kind of those classic hypoglycemia or low blood sugar levels. If you don't feel that, it's really important that you're going to check, because you want to make sure you're safe. And then having ketones from those high blood sugar levels. And one thing I don't have on this slide that I think would be important to maybe even, talk to your doctor about. A lot of individuals now are wearing what's called continuous glucose monitors. Some require you to still do your finger sticks on a regular basis, others do not. But what they do is it automatically tracks your blood sugars throughout the day and night, so that you can see your sugar levels over several hours to see your trends. So what it does is CGM works through a tiny sensor that's inserted under your skin. And usually this is on the belly or the arm. And that little sensor can transmit, can test your blood sugars every few minutes. And then the transmitter on there will send, wirelessly send the information over. So you're seeing them more and more in individuals with diabetes, type 1 a lot, and then some type 2 diabetes as well. So just something to, ask your doctor about. Okay, so how and when to check your blood sugar. So how, you want to make sure your hands are clean. So if you have any kind of residue on your hands, that could affect the reading. So you want to make sure your hands are clean. You're going to insert your test strip into the device. You're going to use the lancing device that comes with it, that has the needle in there, and you're going to actually get the on the side of your fingertip, you're going to prick it, and then you'll start kind of touching it, maybe holding, kind of milking it a little bit to get the blood out, and then you are going to hold that strip that you inserted into the meter against that blood drop, and your blood drop should work, and it should display onto the meter. If for some reason it doesn't, which sometimes does happen for various reasons, like maybe there wasn't enough blood when you did it, or whatever the reason may be, you can actually try it again if you have to, but hopefully it'll work. And then you can just see your blood sugar level right there on the meter. Okay, so your doctor is probably going to be telling you, or you may already know what your blood sugar, when they want you to be testing your blood sugar. But generally, a lot of individuals will be doing it fasting. So that's usually before you eat anything in the morning, and then before or 2 hours after the start of your meal. So get into the habit of doing, talk to your physician, see what he or she wants you to do when it comes to testing. Okay. All right. So as far as target ranges, these are ranges that are based on American Diabetes Association goals. But what I will go over first is, why do you want to have target ranges, right? So why do you want to have goal ranges? So it's going to help you with diabetes control. So it's gonna if you look at those ranges, you can observe what makes your blood sugar rise and fall. It'll keep track of how well your diabetes is controlled. And as I said, you can do it in the morning, fasting, and 2 hours after varying meals. Sometimes people do that to get different results throughout the day, to kind of see, maybe one day they'll do morning and before bed, the next day morning and before their dinner meal, and kind of do that, scatter those tests out a little bit. Just some ideas of things that can actually increase your blood sugar. So things like these would be physical inactivity, but actually sometimes even exercise can increase your sugars. Stress. This could be, a big move, a divorce, anything that can stress you out can cause those sugars to go up. Being sick, a little common cold can actually do dramatic increases in blood sugars. Obviously, eating too many carbs, that can certainly affect your blood sugars. And then maybe not enough diabetes medication. So let's say, you're doing everything you're supposed to, you're eating right, you're exercising, but you're still seeing some numbers that you just don't think are good. It could be that you may need that your medication regimen a little adjusted. So that would be something you would want to bring up to your doctor. Okay. And then factors that can actually cause your blood sugar to go too low could be if you are skipping meals. So you just decided you didn't feel like eating breakfast that day and you didn't eat anything all the way till lunch. That could affect your blood sugars. Or let's say you decided to go on a really strict low carb diet suddenly and you were not used to doing that and your body kind of had a hard time adjusting to that. That could cause, or so especially if you're doing that on an empty stomach. So keep that in mind too. Okay. And then just so you're aware of the goals, the ADA blood sugar goals, so the lower meals that range 80 to 130. And then after the start of that meal, 2 hours after that start of the meal, below 180. So you want to ask your doctor what your personal targets are. So sometimes they could be different than these goals, and that's okay. They're individualized. These are just guidelines. So these can be different depending on how long you've had diabetes. Your age. So if you're a 25-year-old newly diagnosed, you might have a little bit of different goals from somebody that's 85 and has other medical conditions. If you have known cardiovascular disease or very advanced microvascular conditions, you might have that. Hypoglycemia unawareness, which I talked about earlier, where you don't feel those symptoms of going low, you might actually have a higher target so that you don't go too low. So we maybe don't want you to get down to 80. We want maybe to stay at 100, for example. So they're all very individualized. So again, when I was mentioning talking to your doctor about A1C, talking about target goals is also a super important thing to do, and to follow up with your physician about. Okay, so it's also important to keep a log, whether it's from a app, whether it's from your meter, or actually writing it down in a blood glucose log. So this would you would record your time and your blood sugars were throughout the day, breakfast, lunch, dinner, time and night. You check your sugars. And of course, you want to write the result down. And then it's important to write meal details. So, and or if you're putting into like an app, putting down your feelings. So maybe you say, I was feeling very stressed. I'm in an argument with my mother, and I think I ate a bunch of food that night. Anything that you can write in there to trigger yourself to help you realize why maybe the morning number the next day might be high, or that evening meal was elevated because maybe there are some things going on. So a lot of smart phone apps are available now that clearly weren't available, years ago for keeping your logs. So an example, my sugar diabetes logbook, that allows you to monitor your daily blood sugar level in there, and you can record your insulin levels. You can use the app to actually track carbohydrates. That's a common one. My Glucose Buddy is another one. This one tracks your blood sugars, medication, A1C, and it actually logs weight, I believe, and blood pressure in that one as well. And then some of these other ones are just also good ones. On Track Diabetes, Diabetes Tracker, Diabetic Connect, and Blood Glucose Monitor Diabetes. I do feel like the first two are the ones that I seem to see the most, but yeah, give them a try. Give them a try. Okay, so let's say you go low. This is just a general information on how to treat somebody with a low blood sugar. So what you would do is you would notice, oh my gosh, I'm 58. This is too low. I'm going to eat 15 grams of carbohydrates. So the first thing you do is you're going to eat those 15 grams of fast-acting carbohydrates. And these examples listed here are just, a couple examples, but a half a cup of fruit juice, maybe 5 to 6 ounces of regular soda, 8 gummy bears or lifesavers. And again, this can be any, not any candy, but fast acting carbohydrate candy. So typically like, you can do Skittles or something that's gonna get into your system quickly. So you wouldn't wanna do like chocolate because there's protein and fat in there, and it'll take a little long to get into your system to really quickly get that sugar up. So you want that fast acting, what's gonna get in the system quickly to get my sugar up as quickly as possible, because I'm in the danger zone. And then 1 tablespoon of sugar or jelly. So sometimes that's all you have in the house. You don't have all these things. So just making sure to have that, wait about 15 minutes, and then check it again and see where you're at. And if you're still low, then you just got to keep repeating those steps until you can get into a better range. And you want to make sure you eat a meal or snack within an hour of that low blood sugar. And something to point out, is the portion sizes, because I think sometimes it's really easy to go the other direction and then have a rebound where you then are now way too high. So it's important to serving sizes and actually taking that. Don't it rebounded, then all of a sudden you're 250. So we got to be careful there. Okay. Hopefully that makes sense. Okay, so let's say you have type 2 diabetes, you managed it maybe with some diet and exercise for a little bit, but then you go to your doctor's office and they want you to maybe try a medication. So again, diabetes can be managed through lifestyle, but sometimes you need to add pills, injectables, insulin, something a little more to get your blood sugars down. There, as I said, so many different possible combinations of all these things now, since so many are different ones are coming, to the market. I would highly recommend seeking out a diabetes education program in your city that you live in. Maybe group education, support groups are great for your diabetes. Okay, so these are just some examples of what you may see. So in insulin, again, this is because your body's not making enough or not using it properly. Some people need to inject it. So with type 1 diabetes, as I said before, your body's not even producing enough insulin. So that's what you need to have to treat your diabetes. Type 2 diabetes is when the body's not using the insulin properly. So as it says here, there's many, many different types of insulin sold in the United States right now. So sometimes you'll see it in vial and syringe, sometimes it's in a pen form, an insulin pump. There's many different varieties now. There's also injectable medication. So these you may see as well on the market. So they're not insulin, they are injected like insulin. So just something to keep in mind as options. And then oral therapy. So these are only going to be able to be used for people with type 2 diabetes. So if you have type 1 diabetes, you can't even take an oral medication, or you can, but primarily you're going to be taking insulin. It works best when you're using diet and exercise, and it's usually most helpful for newly diagnosed. So again, there's no best pill. There might be a combination. Doctor might start you on one and then have to add another one, take out one. Happening as throughout the course of diabetes. Okay. So the final part here, and before we get to the diet, I guess, is we'll talk a little bit about complications. So obviously we're talking earlier about, trying to stay as much into those goals as possible, the 80 to 130 goal, because the point of it is we don't want to have any complications. And as you probably are aware, diabetes can affect your entire body. So as this picture shows, it can affect your eyes, your teeth, your gums, your heart, kidneys, even your sexual organs, your blood vessels, nerves, and feet. So it can just affect the entire body. And we're going to put these down a little bit, not get into so much detail, but kind of show you what I mean by that when we're talking about the whole body. So for microvascular, what those mean are the smaller nerves. So those are your eyes, and you might have heard the fancy word retinopathy. That can happen. Kidney disease, so diabetes is a leading cause of dialysis, so nephropathy or kidney disease. Nerves, so this would be neuropathy. So you've probably maybe heard of people with issues with extremities with their feet. So that's kind of more microvascular. The macrovascular to the right there with the picture of the heart is just if you have diabetes, you have a higher chance of having cardiovascular disease and stroke and circulation issues. So just keeping those blood sugars in control as much as possible is going to definitely help minimize the risk of having this happen to you. And then there's a whole host of other complications that don't really fall into like the micro and macrovascular area. For example, depression. So things like depression, diabetes distress syndrome, patients with diabetes have a greater chance of depression for various reasons. The stress of daily diabetes management, that can build over time, always having to worry about your disease. And some people may feel isolated or alone in that. And that's kind of why I was mentioning those support groups, because I really do feel that those can be super duper helpful. So you don't feel so alone. And then skin disease, acanthrose nigricans, that's like when you might see somebody have a darkening area kind of maybe on their neck or by their armpit area or something like that. That can be from insulin resistance. Vitiligo is another thing that you might have seen. Gum problems. So sometimes dentists can detect these when the patients come to see the dentist. Higher risk of periodontal disease. So poor diabetes control can cause gum disease, and you're just at a higher risk of having infections of the gum if you have diabetes. Okay, so we talked about complications, and the thing that you want to probably know is how do you prevent getting any of these. So can't say it enough, blood sugar control. Keeping that A1C under 7 for most people, again, could vary for you. Getting it checked every 3 to 6 months, and keeping those blood sugars in the target range as much as possible to prevent any elevated blood sugars causing these complications. Regular checkups, so seeing your diabetes doctor every 3 to 6 months. They should make sure to check your feet, blood pressure, your weight. So maybe, if they're not used to checking your feet and you want them to look at your feet to just make sure everything's going okay with your circulation and whatnot, I always tell my patients, just take your socks off and have them ready to go, and they'll examine your feet. Um, and then annual eye exam. So just making sure that you're getting your eyes looked at to make sure that there's no damage and that you can do stuff proactively. So get that done every year. And then some lifestyle type things too, like if you do smoke, trying your hardest to, work on getting that, to stop. And then watching your labs, maybe your numbers. So with your blood pressure and your cholesterol control, and being on a healthy weight is super important in this whole diabetes thing, keeping your weight at a manageable level as well. Okay, and this is just a very high level overview of what you can eat. So the thing that's going to contribute to raising your blood sugar is going to be those carbohydrates. So it's important to work with a diabetes educator. I know I mentioned it a little bit a couple slides back about to connect with somebody in your community or in your doctor's office about best choices for going over maybe some a meal plan and working with a dietitian or a certified diabetes educator. Typically, insurance will cover. Plans are different, but that would be something to look at. In general, though, you want to have consistent carbs at meals and snacks, and amounts can vary depending on your individual needs. And you can start with that plate method, and there's more details on what that plate method is actually is on that eatright.org website, but it goes through dividing a plate up a certain way to make sure that you're getting some nutritious food, but also not raising your sugars up there. But certainly I would, if you haven't already, I would highly recommend meeting with a registered dietitian and or a certified diabetes educator, which could be a registered dietitian or a nurse or a pharmacist or something. So okay. Awesome. So as far as questions, I'm going to go ahead. It looks like I got a few already coming in, but feel free to use the question tab on your toolbar if you have a question that you want me to, answer, or if you have something you wanted to share that maybe worked for you in your diabetes journeys. But I'm going to start, again, feel free to ask me some. I have the first one being, will I pass out if I go on insulin? So the first, and this would be, hypoglycemia is what I'm guessing that may have been the thought process on. So insulin is, as we talked about earlier, it's going to lower your blood sugars. That's what we give insulin for, to lower blood sugars. Now, sometimes for various reasons, maybe not eating, maybe too much insulin, maybe activity levels, whatever the reason may be, it could cause you to go too low. And that's where, if you've seen people pass out or things like that happen, due to diabetes, it could have been from a low blood sugar. But again, as I said earlier, keeping your blood sugars in that target range as much as possible, making sure to check your blood sugars if you're on your way maybe to a low or you're not sure, have your meter with you at all times to check, and making sure as much as possible to have a consistent carbohydrates. So then you shouldn't have to, worry about that. But again, always having your blood sugar meter testing as much as possible if you're feeling like you are not sure if you're going low. Okay. And I believe the next question is related sort of to the similar topic, is asking if juice is better than soda to raise my blood sugar during a low blood sugar. So they're both going to do the job when you're needing to get that blood sugar up as quickly as possible. So half a cup, it's again the portions, and about a half a can of soda, which is more like 5 to 6 ounces. So it's a slightly more on the soda than it is the juice. So whatever you really have in your house that fits that fast-acting carbohydrates will do. Again, I did highlight that earlier. Just make sure that you stick to the portions because you don't want to have the rebound effect where all of a sudden the blood sugar is going up. Okay. Okay. All right. And then the final question I have looks like it's related to tired. So it says, why does my diabetes make me tired all the time? Okay. So first and foremost, I would recommend speaking to your doctor if you're feeling fatigued, just because it could be from diabetes, but fatigue can be from other things as well. So want to mention, just make sure to follow up with your doctor on that. But if you are feeling tired, it could be possible from a high sugar or uncontrolled diabetes, because that can make somebody tired. So underlying conditions also, like maybe diabetes related complications, those can also factor into tiredness, because damage to those organs can cause fatigue as well. But again, if your blood sugar levels are high, your sugar's not getting out of that bloodstream into the cells. So the cells are just kind of hanging there waiting for that sugar for energy. And when they're not getting it, it makes you tired. So it could be from that. But again, I would follow up with your doctor just to be sure. Maybe you need a diabetes adjustment in your treatment plan or something. So, okay. Okay, well, that looks like all I have for the questions. Thank you so much. I'm just gonna click over here and sort of show you these. If you're interested in any of these upcoming live events, please, please, please let your diabetes coach know that you can send, and they can send you a schedule. But for the upcoming ones, we have Embracing the Holidays Without Deprivation. That's healthy eating strategies for every festive eater. That's kind of a fun one. That's November 5th at noon. And then we also have Take Control. And this is inspiring tools and tips for becoming your own diabetes coach. And this is December 3rd at 6 p.m. So just keep those dates available if you can, and would be happy to have you join us. So it looks like we're kind of all done here. Thank you so much for joining us today. Again, feel free to check out our future webinars, and I am very appreciate your attendance and your participation today. Have a great day. Bye-bye.